So I guess the question is, do your patients come into your office asking if they're pre-diabetic, or is this something that you, after taking a history or looking at the blood work, become concerned about?
Yes, yeah. Diabetes is a major risk factor for getting a heart attack or a stroke in your future. And heart disease is one of the top reasons why people die in the U.S. And so many of these people that do have heart disease or a stroke or a heart attack have diabetes. And if we can prevent progression to diabetes or reverse prediabetes, then we may be able to prevent a stroke or a heart attack, which can be devastating, including death.
So you're saying you can reverse prediabetes?
Oh yeah, yeah.
And how does one do that?
Lifestyle changes. So getting your body mass index, under 25 by a good, healthy diet, and exercise. And there are many types of diets. The best diet is the one that works for you. But it's important to start it right away, not delay it. Because there's recent evidence that shows the longer that you are a certain weight, the more likely that your thermostat in your body is going to keep you at that weight. And it's going to be very difficult to, change. We know people who are a certain weight and they may have been a certain weight for a long period of time and they just can't lose weight. And they'll say, well, I am eating healthy. And indeed they are. They're eating healthier and they're trying, but they're just not losing weight. There's something that we're learning more on a molecular level and a genetic level, and that keeps you at that set point. So you might have gained 20 pounds in over a year period of time and have kept on that 20 pounds for about 3 years. It's gonna be hardly hard to lose that weight unless you gain that 20 pounds in a few months and then lose it. That's easier to do. Science is finding. So so as far as the weight factor and getting off that excess of fat, that's really important. Why is fat important? Well, in diabetes, which we can also say it's insulin resistance. So your insulin isn't effective in taking that sugar inside your blood vessel and giving it to your cells for energy. It's kind of just sitting there because the cells are resistant to that insulin, that key that unlocks the door and allows sugar to flow in. So what happens is this: science has found that there's increase in inflammation in patients with prediabetes. And so there's this debate whether does the inflammation come first and cause insulin resistance, or is it that you have insulin resistance or prediabetes that cause inflammation? I think both sides are correct. We know that in cells that are insulin resistant, especially in fat cells, they release molecules that recruit your immune system to come to those fat cells and start wreaking havoc. Because the way the body might be thinking, okay, this is a bad cell, I need to be destroyed, and which is not good, right? But the individual cells, your immune system doesn't know that, but that's what happens. What we're seeing in insulin resistant cells, and that's a mechanism why there's damage that occurs on a cellular level in insulin resistance. So what happens then, you get all these inflammatory markers released. They recruit your immune system to start damaging stuff that doesn't need to be damaged. And that can be, cells, and not just fat cells, but cells inside the lining of your arteries, which then causes damage to what it's called the endothelial layer, which is a very sensitive layer of the inside of arteries that controls your blood pressure. Now we start having blood pressure issues. And when we have blood pressure issues, that's increased force in the arteries, more damage to the arteries. Eventually we have, scarring of those inside of the arteries, damage, healing, that causes plaque formation, narrowing of your arteries, which eventually leads to, a heart attack or stroke, an embolism if when that plaque breaks off, or a complete narrowing to an occlusion, which can lead to a heart attack or a stroke. So inflammation is a big part of this. Also, the high blood sugars probably contributing to the inflammation, and inflammation also contributing to the high blood sugars. And this all can be mitigated in the pre-diabetic level, I think, with lifestyle changes. Even in the diabetic range, I mean, you can reduce inflammation by eating an anti-inflammatory diet. There are numerous types of vegetables and fruits that help reduce inflammation in the body, and not doing things that cause inflammation in the body either. So if you prevent inflammation by eating healthy, by exercise, reducing the fat in your body,
Mhm.
you can reverse that insulin resistance when caught early enough.
So you talk about this process. How long is this process? How long does it take? You said if you can drop the weight within 3 years, is that the real marker of time? And what are some of the things that I should be thinking about over those 3 years? And how does one lay that out if they're pre-diabetic? Because this sounds like a lot.
Yeah, not over 3 years. I think I'm giving an example of a person who has had this amount of weight for 3 years. It's going to be very hard for them to remove it. So you can have a BMI over 30, which is obese. That's over 25, according to the CDC, would be overweight. Over 30 BMI is obese. Now that's someone who doesn't have a lot of muscle, and this is an average, because there's a lot of bodybuilders who have a BMI of 35 and have like 7% body fat.
Mm-hmm.
I'm not talking about that subgroup. That's different. But it's going to take it will take a couple months, maybe 3 months, to try to reverse that inflammation. It doesn't happen in a week, and it might not happen in a month, but we see this over several weeks. We can start reducing your blood sugars, and reducing what we call the A1C is a 3-month marker of the average of blood sugars in the body. We can see reductions in something called high sensitivity CRP, or HS-CRP. That's the amount of inflammation in the blood vessels. That correlates with you having increased risk for a heart attack or a stroke. And we see these increase in high inflammation states. We see it like in people who are smokers and tobacco users have high HS-CRPs, uncontrolled diabetes, high blood pressure, people who have active heart disease. And that's something we can trend to. We have healthier lifestyles. We can reduce that inflammation, that HS-CRP, and that takes a while. I would say give yourself a good 1.5 to 2 months to start noticing changes. So I can't remember where I heard this, but for every year of badness that you become accustomed to, it's going to take a month of healing at least. So imagine that 12 years of not living healthy. It could take a year of being steadfast in lifestyle to help reverse this or make a dent in the damage that's been done.
So you can see that physically when you lose weight, right? You feel better. Your metabolism probably changes. How do I know what's going on inside my body that correlates with that? And it sounds like maybe inside changes could happen quicker than outside visual changes.
So Initially, with weight loss, you might feel more tired because you're probably caloric restricting more than what you're used to. In theory, that fat that is going away may be releasing toxins, and I've heard this before and heard it from other patients before, that they don't feel very well, the first few weeks of doing this process. And that should not discourage you, because there is a reason why people feel the way they do when they make changes in their life. It's a shock to the body. But there are things that you can check to know that you're going in the right direction. For instance, high blood pressure. Check your blood pressure. We want to get it as close to 120/80 as possible. Blood pressure, of course, is a separate topic all itself. What blood pressure, what's optimal, is hotly debated over the last 30 years. That it has ranged from 140/90 is okay, down at one point they said get the lowest possible without you getting dizzy, and it depends on if you have kidney problems, or if you have this other problem, you might need a different goal. That's all. It's confusing. What I tell patients, what I look for, let's get to 120/80. I think that's reasonable and it's healthy. That's one thing you'll notice, a reduction in blood pressure if you have high blood pressure. A second thing would be, you generally get to a healthy body mass index of 21, 22. That's take your weight and height, and there's lots of things, apps you can use to plug that in, and that's getting to the ideal body weight is healthy. That's another way to know. You can also check, if you do have prediabetes, you can check your blood sugar. The caveat to that is there's no studies that show that regular checking of blood sugars, even if you have a type 2 diabetic, has been shown to make any impact on health outcomes. So, for instance, if you had diabetes and it wasn't severe, does checking your blood sugar make an impact in outcomes? No, but it gives you information that lets you know, like, oh wow, my blood sugar average has moved from 120 fasting down to 105 fasting, which is still in the pre-diabetic range. You want to actually get it below 100 fasting average, but that's another thing that can tell you, hey, I'm on the right track. And then getting an A1C. A1C is an average of how much blood sugar is on red blood cells. Red blood cells live for about 3 months. From the time they're in circulation, they leave the bone marrow and they circulate for 3 months in your bloodstream. During that time, they attract blood sugar molecules onto the red blood cell, and using an A1C measures how much blood sugar accumulates on a red blood cell. And if we take the concept that red blood cells live for 90 days, we can get a good, by taking the average amount of blood cells and the average amount of blood sugar on those blood cells, we can give a pretty good assessment of what the average blood sugar is over a 90-day period of time. And that's what an A1C tells you. So, an A1C, of 5.7, which according to American Diabetes Association is the pre-diabetic, where you go from non-completely normal from 5.6 to 5.7. Those blood sugars are going to be in the 100 to 120 range on average. Now, as you go up to 6.4, which now above 6.4, that's diabetes. Your blood sugars on average are going to be 140s, 150s fasting. So, or not fasting, but average 140s and 150s. Mm-hmm. So we can check A1Cs every 3 months. I can see a difference in A1C even checking in a month later. It's not going to be a big change, but it's going to be a change nonetheless. There's other interesting things. They're called continuous glucose monitoring, or CGM. The big ones, Dexcom, where it's a device that attaches to your skin, and it sends information to a meter. You can see at any point of time what your blood sugar is. That's continuous blood sugar monitoring. There's another one, it's more intermittent. It requires you to scan the meter. That's called a Freestyle Libre 2. I have a patient that uses that. And after she started using that, she was able to know, wow, my diet is really affecting me. She didn't have to poke her finger anymore. She just goes, chip, it beeps, and then she can see it. And it's about a 15-minute lag time, but it'll tell her, like, yeah, I shouldn't have had that orange juice, or I shouldn't have that banana. I shouldn't have that carb. I should have stuck with a salad with your green leafy vegetables, with your sprouts and avocado and sliced bell pepper, with garlic and olive oil, instead of that banana or fruit bowl, which many people feel is healthy, and it is. But if you're diabetic, that sugar is going to spike insulin. Insulin spike causes a chain of reactions, causes catecholamines to be released from your adrenal glands, and you just don't feel very good, because you're on this up and down roller coaster of all these chemicals circulating around, all because you can't process that bolus of sugar that you just ate effectively because you have insulin resistance. So that's why people don't feel good when they have diabetes, and if they eat poorly.
And if I'm pre-diabetic, but I don't know that I'm pre-diabetic, but I'm aware of the fact that I don't feel too good.
Yeah.
And I don't plan a healthy diet because I feel I'm not diabetic. I don't need to worry about it. It kind of sends off a radar that there's something going on in my body, and it isn't just some external factor.
Yeah. There's other things you look for too. I think you might have pre-diabetes. So if your body mass index is over 25, if you have a first degree relative with type 2 diabetes, if you have certain conditions, there's something called acanthosis nigricans, and that's a dark thickening on the back of your neck. You might see this in some people, like the back of their neck is really dark, and it looks like almost really thickened. And we see these in pediatrics to adults. And that is an independent risk factor for, diabetes. So family history of that, overweight, frequent infections. If you have frequent skin infections, you might have a compromised immune system, which, increased sugar that can predispose you to more bacteria or fungus growing more than usual, because they need a food source.
Mm-hmm, mm-hmm.
Sugar.
So what about, you had talked about inflammation as well, and the concern of developing cardiovascular disease. How does, I obviously wouldn't know of that visually. What kinds of things can I find out, or how do I know if I have that inflammatory response, and how do I take care of that?
So you check, there's something called, like I mentioned earlier, HS-CRP. That's a blood test that your doctor can order. If it's above, ideally, under 1 is good. If it's above, 3 to 5 range, and that's kind of borderline. Many people, it's above 5. And that should tell you, like, I have to do some things in my lifestyle to reduce inflammation, to give me a better chance of fighting inflammation that can cause a heart attack or stroke in my future, be it 10 years from now. But things build up slowly over time, and like I said before, 10 years of badness is going to take a year of healing.
Okay, so these lab tests, I happen to know that you do these lab tests yourself. So if I come to see you, I get that information right when I see you, and you're able to tell me how I'm doing or help me answer any questions I might have until another visit.
The biggest tool I like is the point of care A1C. I just absolutely love it. It's a small little device. I'll do it, or my RN will do it, and say, hey, let's get an A1C. You have risk factors for diabetes. You might have pre-diabetes, and let's figure this out and make a lifestyle plan until we meet again in 3 months and recheck it. I'll sometimes order what's called a advanced lipid panel, and that's probably another discussion. But the advanced lipid panel typically adds in a high sensitivity CRP, and plus it breaks down the other lipids into small particles and large particles. Particle size is important, not just if you're LDL cholesterol, but how big are these cholesterol particles? Small little particles tend to lodge into the endothelial lining arteries, causing inflammation, whereas big bouncy bad cholesterol particles, they don't really do much. Well, they do because they're important. They carry things from place to place. That's the reason for cholesterol, and also building blocks of cells and other things. But we don't necessarily want to have low cholesterol. We want to have low bad cholesterol and normal to good cholesterol. Cholesterol is good. Without cholesterol, we wouldn't have hormones. We would not have cells, cell walls. We would lack defenses. We do need cholesterol. So, but I'll order that, something like that. Now, you might see a CRP versus HSCRP. HSCRP is more geared towards general inflammation, what's happening in your blood vessels and your bloodstream, whereas CRP, without the HS, is more of a marker of you have an acute infection, a bacterial infection, for instance, or you have a pneumonia. So if I'm suspecting an infection in somebody and or they're not feeling well, and I can't find a source, I'll order a CRP. If it's elevated, I might think this is a bacterial infection. I can't treat this with oral antibiotics. I'm gonna send you to the hospital for IV antibiotics because I think that's what you need, because this CRP is super high. And whereas an HSCRP is more along the lines of you have a chronic inflammatory problem going on that's probably caused by lifestyle problems. And so the HSCRP is what I would choose to manage that part. So there's different CRPs, and that's important to distinguish. So the CRP is something we can do in office. I think it's the regular CRP. I don't think it's the HSCRP that's in the Piccolo machine. But I think Glenna has a way to check HSCRP. We'll have to see that.
Okay.
But the A1C is absolutely pretty cool. Another thing, random blood sugar check. Random blood sugar checks are clues to diabetes or prediabetes, but they're not going to be an all-in-one diagnosis, because blood sugar changes throughout the day. Depends on if you're sick at the time, or you're nervous, or fasted, or ate. So in general, if you have a blood sugar over 200 at any time, that is a clue that you probably have diabetes. If your blood sugar fasting is over 126, fasting overnight, that's a clue that you probably have diabetes. Okay. If your blood sugar is between 100 and 126, or 100 125 fasting, that's a clue you have prediabetes or some amount of insulin resistance. 100 125, all right, fasting. But it's recommended that individual blood sugar be rechecked at a different time to make under different circumstances to make sure that's consistent. there's a person that had a really severe infection recently who I had to send to the hospital, who had a blood sugar over 200. Didn't have diabetes, but he had a massive infection that required hospitalization. So infections release other hormones from your adrenal gland to help solve problems. And sometimes these chemicals do raise blood sugars up in the body.
Oh, that's
Because of
misleading.
inflammation, because of stress. So stress can cause increased blood sugars. Certain medications like prednisone and steroids cause increased blood sugars. Cortisol, which is the stress hormone, increases your blood sugar.
Mhm.
You know, stress by itself, chronic stress, mental stress, emotional stress, is equivalent to tobacco over time as equivalent risk for getting a heart attack, because it releases inflammation. It causes inflammation.
Oh,
So just stress can release blood sugar. So yeah, those are some important concepts I just went through.
so what about age? What does age have to do with it? Because we have heard in the past it would be middle age and higher, and now we're seeing what I believe to be younger
Yep.
onset of diabetes.
So 1 in 3 Americans have prediabetes. 1 in 3. 1 in 10 have type 2 diabetes. It's projected that 1 in 2. Now this is a projection that I read about a couple of years, more than a few years ago. 1 in 2 children born today will get, insulin, some kind of insulin resistance in their life, which is huge. And we don't know exactly why that is. We can assess it's probably due to chemicals, more industrial chemicals, more refined foods, less nutrition to help fight inflammation in our body. See, our environment tells our genetics what to do. If we don't have those triggers, those cues from our environment, our genetics aren't going to know what to do. And lack of vitamins is a lack of getting to our healthy potential.
Okay.
That's one thing. The second thing is there's toxic burden in our environment, and that's from air pollutants, pollutants in our water, pollutants in our cosmetics that we use, in our soaps, in our detergents. The jet stream brings, from different countries, mercury and heavy metals through the air to other countries. I mean, this is all proven to be a total fact. It's also proven that these chemicals act to block processes that are beneficial to happen in the body.
Mhm.
These can be the interactions of how hormones attach to receptors in cells and turn things on and off. So we have these toxins that block that from happening.
Mhm.
That makes the body confused, cells go haywire, and anytime there is any haywireness in the body says, I need to kill that now. And so that's where the cells would release in markers of inflammation. Hey, kill me, I'm a reject. And so your immune system goes, and that releases more chemicals in the body, and that can cause inflammation. So it's a very general concept that's pretty easy to understand, but there's so many nuances to our immune system that we don't know everything.
Right.
But the question is, well, we're having more and more younger people get diabetes. I think that's probably has a lot to do with it.
Right. Right. So the number one thing is to come in on spot, visit with you, and have my A1C measured
Yes.
to let me know what's going inside I'd come in because I'm having some of these symptoms. I either have a very large BMI
Yeah.
over 25. I'm feeling a little off. Maybe I get recurrent infections that I just don't understand why I'm getting them and no one else in my family is getting them. And I'm getting frustrated because it's affecting my lifestyle, costing me money, going to the drugstore, coming, getting medications, or trying to as best possible address what I really am not aware of, especially if I'm pre-diabetic and I don't even know I'm pre-diabetic. But you just told me 1 in 3 people are. So if
Yep.
I'm standing at the bus stop, 1 of the 3 people waiting for the bus is going to be pre-diabetic. And so thank you. I think that's great.